Hey guys, it's Paula Nutting, your musculoskeletal specialist. I thought what we'd do today is have a look at some anteriorizing and posteriorizing of our ilium, because it's all about how we can manage the pelvis and sacrum to make sure that the body is going to have a nice stable platform so that the spine and up to the head is in alignment and balance, and the lower limbs are the same. So when you have a look at your client or patient, you're going to actually first do your ASIS heights and see where they are and if they're even. Then we're going to put our thumbs and feel at the PSIS heights to see if they are actually in alignment. And you can do a modified stalk. So they're going to be standing one leg up, and we'll see the thumb move if it's actually mobile, and if the thumb will either stay still or roll up, which is even worse if they've got a fixation of the ilium. So it will be an iliolumbar issue, not a sacral issue. So to get us, if someone has got a posteriorized ilium, so the ilia has gone back towards me, indicates that they might have a tight lat dorsi. It also indicates that the hamstrings may not be totally functional. The glutes can be working, but it's more that we've got this tuck in here, so the abs can be a little bit hypertonic. Anyway, great way to mobilize this is to do a muscle energy technique. So in order to do that, we get our patient to lie on the table with their knees in alignment, ankles in alignment, and their hips stacked on top of each other. We're going to take one hand and we're going to bring up that leg and bring it backwards at the same time as we're mobilizing. So my hand is on the ilia and I'm mobilizing it forward. So once I've got it into this position here, I'm actually going to tilt until I get real bind along the front of the quadricep muscle. And then I'm going to ask Brooke if she can pull her knee towards you guys. So pulling forward, thanks for me, Brooke. We're holding about between 30 and 40% effort, and she's going to be doing this for 7 seconds. After 7, she's going to take a cleansing breath. And as she breathes out, she's going to relax. So once we've done that, what I'm going to do is I'm going to rest her leg on me, and I'm going to rock this ilium to try to bring it into an anterior placement. How's that feeling? Good. Yeah, cool. Shouldn't be uncomfortable. Again, I'm going to lock in this femur, and you're going to pull forward again for me, thanks, Brooke. And I'm really holding her PSIS and ilium stable on this side. By doing a contraction at the quadriceps, we get that post-contraction relaxation phase. And relax for me. And during this phase here, we're actually relaxing the quad tendon, the TFL, some of the iliacus and psoas area, and generally allowing for the pelvis to come back into an anterior tilt. We're going to rock it again. There's really no major contraindications into this, but just be mindful that we don't want to give them really aggravate the lumbar spine by moving that too much. So one more time for me, pulling forward. So each time was 30 to 40%, 40 to 50%, and a good 50%, which I think that's pretty much where we are now. Big cleansing breath for me, and relax on the out breath. We're allowing for that nice quietness. We're listening to my mum's clock, ding 9, because it's 9 p.m. And we're just doing a little bit of mobilizing as well. And then gently bring their leg back for them, because we just want to assist in that movement. Once we've completed that, we can check for our leg lengths, we can check for our PSIS movement, mobility, and that should be enough to take a posteriorized ilium back to neutral. This time I thought we'd look at an anteriorized ilium. So it's the same symptom picture, which means we're checking for iliac crest heights, and they should be even. Sometimes they can be a little bit out of whack, and that's because the ilium can be either anteriorized, so the back portion of the iliac crest can be looking like it's a little higher, or posteriorized, which could look a little bit lower. That's really subjective. We're going to have a look at our modified stalk test, which means thumbs just below the PSIS while they do a leg lift. We expect to see the leg moving, and as it moves, we're going to see our thumbs roll down, because when we fixate on that spot and she's going to move her leg, the hamstring pulls at the ischial tuberosity and the whole ilium moves. That's normal. What we don't want to see is no movement, or worse still, an up slip or a movement up, which means that there's really dysfunction in there, and the contralateral QLs or their lateral trunk flexors are actually trying to elevate to maintain some kind of stability, and we just don't want to see that. So if we've assessed that there's an anteriorized ilium by looking at PSIS, one's on this side is higher, and that means that this is going to be up higher and this one's going to be lower. We can have a look at our leg lengths, and we will also see that with an anteriorized ilium, so it's twisted like that this leg will be longer because the femur sits in the acetabulum and comes down a little bit. So how do we treat it? Super simple. Here's my wonderful Brooke that lives on the same floor. She's perfect, and she's all about helping with these. So we're going to take that leg and we're going to bring it up onto our hip. So it's like you're holding a baby. One hand is going to come at the front of the ASIS, AIIS, and the other hand is going to weave around the iliac crest, and if you're palpating along, you'll feel the sacral notches there. So what we're doing is we're rocking. It's actually this part of my ulnar radius complex. I can feel her ischial tuberosity, and I'm rocking back and forward. This is really a joint MET, and that's the ones that Fred Mitchell talked about when he was looking at his osteopathic options to high velocity in-range thrusts. So gentle rocking. Once I feel that bind at the back, I'm going to get Brooke to try her to, she's doing hip extension, but not knee extension. So can you push your knee into my body? So she's pushing down that way, but she's not trying to kick me. Does that make sense? We've got 7 seconds. After 7 seconds, cleansing breath in and relax as you breathe out. And we know that there's a relaxation phase, and breathing in and out will actually assist in dropping the blood pressure a tiny bit. It also helps with deregulation of the nervous system. So we're going to hold that and then re-rock. It's really interesting that 90% of people that have got ilial rotations tend to be anterior and tend to be on the right. Okay, pushing again for me. So don't let her move at all. Remember, it's minimum 10 seconds. And I like to say 7 seconds and a breath in. And relaxing the out breath. And you actually don't have to say breathe in, because all you have to do is go. And it's kind of like this auditory cue for them. This relaxation point can be up to 90 seconds. You don't actually have to do that, but that's the length of time you can get changes in your post-contraction relaxation phase. And I can actually feel the sacral moving a little bit better now. I don't know if you actually had major issues in here, but she's a dancer and does a lot of gym, does a lot of everything. So she's a little tight, a lot of Pilates, a lot of yoga. Okay, one more time for me, please. Pushing down into me. And it's super comfortable for me because she's just pushing into my lateral hip thigh area. And there we go. These are fantastic to use in anything that's involved with the pelvis and the sacrum. And again, when we take that leg, make sure you hold it and you bring it back to not make her contract through that range. So what we're going to do is get Brooke to lie on her back for me. So when she rolls over onto her back, I'm going to get her to bend her knees up, feet flat. Make sure her toes are in line. Can you just push your bum up in the air a little for us? And down. So I'm just doing a Weber-Barstow test. So we've just got her to lift up. I move her legs, but I don't pull them because that's a no. And we look to see if her medial malleoli are in line, which they are. And we look to see if her ASISs are in line, and they are. So we've done a really good anteriorizing and posteriorizing of the ilia.
When you're working from home, you'll find that you get more opportunity to look after yourself rather than less. What you quite often see when you finish work in your office is that you rush home, you change, you sit down in front of the TV, you have dinner, go to bed. So we don't realise that we have this great opportunity right now to really make a big difference for ourselves. So what we're looking at is we're having a look and seeing how tight we are through the inside thighs, how tight we are, whether we have tender points, you know, those your piriformis muscle that people talk about, or your iliotibial, your IT band that people talk about. We can get into those in our own space, which is a really great way to do it. To get into your gluteal muscles, we simply again use our little tennis ball and we'll find that spot and put the tennis ball down, and I'm just going to drop gently, and I'm talking about really gently, and giving a rolling around through the buttocks till I find those points that feel exquisitely tender, and they might have a referral pain. So this one here is just referring down my leg a little, so I know I'm on the right spot. And I can sit into there, big breaths in, and allow cleansing breaths until it's gone, and I'll move to the next point and I'll work on that one too. You'll probably find there's up to 4 or 5 in that area that we can work on. So while we're here, let's also go down and look at our lateral thigh, or our ITB. And again, same deal, we're going to be sliding up and down. Apply the amount of pressure you want, because you can take more weight with your elbow. We're going to go all the way along that muscle and really feel like you're giving it a good release of anything that's tight, any tension in there. And the last muscle group that I want you to consider is the inside thighs, in a way that they will affect your lower back. So tight here and tight here. It's kind of like a seesaw. So we want to take the legs nice and wide, and we actually want to stretch through the side of the trunk. I know it sounds a little counterintuitive, but if we can stretch over like this and hold it for a good 10 seconds, we actually get further down here. We're opening the hip and the pelvis. And you can see straight away, I can come a little further, holding them for 10 seconds each. And then again, look how much further I'm getting. It's great to open up the glutes, the lateral glutes, the ITB, and the inside thighs, and the lower back. It's a great part of a daily routine to keep you strong, flexible, and pain-free.